Chapter 1. A Billionaire's Gambit. The call came at 3:17 a.m. A single name flashed on the screen: Melinda. Bill Gates didn't need to answer to know what it was about, and numbers had been climbing for weeks. The world was on the brink, and the usual playbook had failed. This was different. This was a bet. By dawn, the plan was set. Not just a donation. Not just a grant. A full-scale assault on a problem most had given up on solving. The kind of gamble that could either cement his legacy or shatter it entirely. Gates had spent years studying the art of influence. He knew power wasn't just about money, it was about focus. The world's richest man could buy anything. But what he couldn't buy was trust. And trust in the realm of global health was everything. The first target, polio, a disease that had once paralyzed 500,000 children a year. By the early 2000s, it was nearly eradicated in the West, but in the shadows of Africa and South Asia, it still lurked. Who had been fighting it for decades. Billions had been spent. And yet it persisted. Gates didn't just write a check. He rolled up his sleeves. He studied the data. He visited clinics in Nigeria, where rumors swirled that vaccines were a Western plot. He met mothers who had lost children to the virus. He saw the fear in their eyes and the skepticism in the eyes of local leaders. Then he made his move. In 2005, he announced a $1.5 billion commitment to polio eradication. Not through governments, not through bureaucracies, through a direct, relentless campaign. He didn't just fund the vaccinage, funded the boots on the ground, the workers who went door to door, the educators who debunked myths, the logisticians who ensured no dose went to waste. The skeptics called it arrogance, a tech billionaire playing doctor. But Gates had a weapon they did, patience. He knew this wouldn't be a quick win. It would take years, decades even. But he was in it for the long game. And then something unexpected happened. The numbers started to shift. By 2012, polio cases had dropped by 99%. By 2019, only 2 countries remained endemic. The world was on the cusp of eradicating a human disease for only the second time in history. But this was just the opening move. Gates had always believed that health wasn't just about treating symptoms, it was about systems. And the world's health systems were broken, fragile, unequal. A single outbreak could bring them to their knees. So he turned his attention to the next crisis before it even arrived. Malaria, AIDS, tuberculosis. One by one, he targeted them with the same ruthless efficiency. The Gates Foundation became a machine funding research, cutting red tape, forcing governments to act. Critics accuse him of overreach, of playing God, but the results spoke for themselves. Then, in 2020, the unthinkable happened. A virus emerged that didn't care about borders, wealth, or influence. COVID-19 spread like wildfire, exposing every flaw in the global health infrastructure. And Gates, who had spent years warning about exactly the scenario, found himself in the crosshairs. Suddenly, his past investment cheese partnerships with pharmaceutical companies, his advocacy for global vaccine distribution were scrutinized, twisted, weaponized. Conspiracy theories spread fast, and the virus itself, he was called a puppet, a profiteer, a man who wanted to control the world through health. But those who knew him best saw something else. A man who had made a bet not just on science, but on humanity. A bet that if you put enough resources, enough focus, enough relentless determination behind a problem, you could change the world. And in the end, that's exactly what he did. But the story wasn't over. Not by a long shot. Because the next chapter was just beginning.